Today we'll talk about how we plan for radiation and what are the different steps involved. The more common tumor types we radiate is the nasal, brain, prostate, oral tumors. So we've talked about why radiation is important and when all we can do it. I'm just going to go through the different steps that are required for radiation. So the first thing that we need is a CT scan for radiation planning. So even though you would have probably done a previous CT scan, this CT scan is a little different because what we do is we need them to be completely still during the anesthesia, during the CT planning for radiation. So we also use certain immobilization devices. So this blue mattress that you can see here in this picture is called a Vaclock bag, which contours to the body of the animals. And then we also have a face mask or a mouth mold, as it's called. This is to ensure if you're treating head and neck tumors that they don't move and we have as much precision as possible. So we have our patient getting a planning CT scan done for radiation. We also have them on gas anesthesia because general anesthesia is required. Once the CT scan is done, then we plan off this CT scan. What we are doing now is called contouring, which means telling the computer what is the tumor. So this right now, orange line is where you can see the tumor, right? All of this is the nasal tumor that we are treating. But outside of that, we are also telling the computer where the eyes are and the lenses are and the brain is. Tell the computer where is the eye, where is the brain, and where is our target, which is where is the tumor exactly. So we draw all these structures like we would on with a crayon. Then we give certain doses to these structures. So our main goal is to giving the maximum dose to the tumors and as little dose as possible to the surrounding tissues. And because now we have access to more advanced technologies like intensity modulated radiation or image guided radiation, also certain machines which can do stereotactic body radiation, we are able to achieve that target of giving maximum dose to the tumor and minimizing dose to the surrounding tissues, thereby reducing the side effects. So once planning is done, and that's what we are doing right now. So here what we are doing is basically planning. So different colors correspond to different structures. The right lens corresponds to this yellow line here. The PTV corresponds to this structure here. This is the doses that the structures are getting. So this is where we are planning now. After that, we go on ahead and do a quality assurance on the actual plan. And this is to ensure that the actual machine is able to deliver the dose exactly as we have planned it. The plan passes quality assurance, only then can we treat. We use the same Vaclock bag and the immobilization device for each and every treatment so that we don't treat something we are not supposed to. Also, before every radiation treatment, we do something called as a quick MVCT scan, which is to see if the positioning is accurate or not. In this image, that's what we are seeing. We are trying to see if the positioning that we did for the radiation planning and the position that we have right now is the same. So it has to match exactly, and if it matches, only then can we go ahead and treat. If it doesn't match, we can make some changes and ensure that it matches. Once that is done, then we go ahead and treat. Mostly the treatments last anywhere from 10 minutes to about 20 minutes. The plane of anesthesia is not as deep as we would need for radiation, so most of them go home walking. So that's in short how we can treat with radiation and our whole planning procedure.